Hey, everybody, and welcome back to the Unchoreographed Podcast. I'm your host, Dr. Jenna Lower. Today, we are going to dive in a little bit to helpful treatments for hip impingement and labral tears and things that you can do for it. Specifically, we're going to be talking about manual therapy. Now, this is something that I think is generally what we think about when we're thinking about going into physical therapy to, I guess, for really any body part, but especially for your hip. We think about the hands-on component. I think a lot of times patients believe that unless the therapist is physically touching them with their hands, then it's not good care or it's not worth going. And while that can be somewhat true, it's definitely not the whole picture because there's a lot of other really important pieces of physical therapy that are not just hands-on manual therapy. However, today we are going to talk about when it is helpful. So we're going to talk a little bit through of like what exactly is manual therapy, when it would be helpful in instances that it is something that should be focused on, and also why it's not the whole picture and the other pieces of the puzzle that also need to be focused on to make it more successful. So let's first cover what manual therapy is. Now, if you're out there listening and you've been to physical therapy, you probably have already had some form of manual therapy before. Maybe you've gone to a massage therapist. So at a physical therapy clinic, when you are getting hands-on help, it can look a couple different ways. It can be, soft tissue massage. So much like you would get if you were going to a massage therapist. It could be manipulation. So this is like joint mobilization manipulation where they're actually trying to move and mobilize the joint a little bit deeper. This you can kind of almost think of like what you'd get when you go to a chiropractor. And then there's other types of manual therapies like something like muscle energy, where muscle energy is sort of a combination between contracting the muscle and lengthening it and, then also doing some soft tissue work with it. So it's sort of a combination of you do some movement, the therapist does some manual at the same time. So there's all sorts of different types of manual therapies. Essentially, though, it's when the therapist is physically has their hands on you and is doing some form of soft tissue or joint manipulation to try to lessen your pain, improve your mobility, and just overall make things feel better. Now, the other forms of manual therapy could be non-therapist involved, so where you are physically doing the work yourself. This could include things like foam rolling, using a tennis ball to do a massage, or, like a massage stick or a Theragun or, things like that. So you can still do manual therapies that are not always hands-on by the physical therapist, but that you are actually directing yourself and sort of in control of. That is still considered a form of manual therapy. And I think that all of these things, no matter what type of manual therapy it is, if you are in pain, they are extremely helpful. And so I do believe that there is a huge place for manual therapy when we're talking about impingement and labral tears. Now, does it get deep enough that you're actually going to be touching the labrum or getting to the joint surface or anything like that? No. But what it does do is it helps calm down everything around the joint. So when things are really irritated and inflamed, sometimes it just needs to be calmed. And it's too much to think about doing strengthening or movement. Sometimes you're in so much pain that everything hurts, and you can't be effective with your exercises unless you calm the joint first. And so this is where manual therapy becomes extremely important and helpful. So the places where I tend to use it most and where I think it's the most helpful is in those early stages of your rehab, or maybe not even early stages, but even just if things are very irritable and acute, if you have inflammation, it's extremely helpful on this timeline. What it essentially helps you do is create almost a window of opportunity. So if we can even temporarily reduce and lower your pain, it allows us to then have maybe more effective movement. So if I do some manual therapy, I calm things down. Now I can go in and I can do an exercise a little bit more effectively because it no longer hurts anymore. And I use this all the time in the clinic when I'm working with clients where, we attempt to maybe do, some hip flexion exercises. And their hip flexor is so irritable that no matter how we change or adjust or manipulate the way that they're doing the exercise, it still reproduces pain. But I also know that it's a movement that they really need. So very often what we'll do is we'll say, okay, let's pause for a second. Let's go back to the table. Let's do some manual work. And again, this could look like a lot of different things. It might be manual therapy and like soft tissue massage right to the hip flexor. It might be a little bit of joint mobilization to make sure that it's gliding properly when they're flexing their hip. It might be soft tissue in a different area. So sometimes it's on the back side of the joint so that head of the femur can glide down and back into the joint when they go to flex their hip so that the hip flexor doesn't keep getting impinged on. And so again, it totally depends on what your situation is, but this is just a few examples. And so we do that, and then we go back to the exercise. And many times if we've targeted the root of why it was happening and why it was feeling that way, they're able to complete the exercise and things feel better. And so it can be used really strategically within a session, within a week, over a longer period of time to allow this window of opportunity where now you can do the exercises in ways that are much more efficient and they don't just keep flaring your symptoms. So when used that way, again, it's an invaluable piece of the process of getting you out of pain. Where I think it becomes not helpful or it becomes a problem is when it is believed that that is the only thing that is going to make your pain better. If it is the only focus, then you are missing a huge piece of the puzzle and it's not going to solve the entire problem. It's helpful in those early phases to calm the symptoms, but then at a certain point, you have to take this relief that you're getting and you have to use it to your advantage to actually target the root of why you're even having these problems in the first place. And that means we have to dig into how are you moving, changing your movement patterns, and then layering strength on top of that so that it's making all these changes stick. Now, if you guys have listened to me for a while, I'm not a fan of jumping forward into strengthening, which is why we don't necessarily start here. It's really helpful to start with maybe a little bit more manual therapy or foam rolling in the beginning. But if that's the only thing that you are ever working on and you're never moving through these next phases of how do I retrain my movement? How do I layer strength on top of that? The changes that you're getting with the manual therapy, no matter what kind of manual therapy it is, they aren't going to actually stick. And so what happens is you do the manual treatment, it feels better, but then it comes right back. And you get stuck in this cycle, this back and forth of I do these things, I foam roll, I massage, whatever it is, I feel better, and my pain comes back because I've done nothing to change why it keeps getting tight in the first place. And this can be true if you are somebody who is struggling with a lot of, tension overall. Maybe it's not the movement patterns and the strength that we're needing. Maybe it's your nervous system reset, right? So there's a lot of different reasons that may not be sticking. But another big one is your nervous system. So we can do soft tissue work and we can calm everything down. But if your nervous system is still telling your body to tense back up, and you're sort of in this fight or flight, I have to protect all the time, it's just going to keep tensing up. And so while it might temporarily reduce with manual therapy, as soon as you get off that table and you go back to moving the way that you were moving and your body perceives it as a threat, it is going to tense and tighten right back up. And this is why it is so crucial that if you are doing the manual therapy, alongside of it, you are doing the movement re-education piece and eventually the loading and strength piece as well. You'll just get caught in this cycle otherwise, and nobody wants that. Nobody's got time for that. I see this all the time too if somebody is not working with a physical therapist, but they're working with a massage therapist. And they're like, I don't need physical therapy. I'm doing massage therapy and it is better. And then I ask them, well, how long have you been doing massage therapy for? And they're like, 3 years. And I'm like, well, is it really better then? Because what's happening is you're having this dependency on needing to go in to the massage therapist. And I'm not bashing massage therapy. I love massage therapy. This could be exactly the same with a physical therapist who is only doing manual therapies. I shouldn't say massage therapist. I should say any practitioner who's only doing manual with you. But if you've been doing the exact same thing, no matter what it is, for 3 years and nothing has progressed, then that's probably a sign that what you're doing isn't actually working. It's creating a quick fix, which can be super helpful, right? Like, we still like quick fixes, but at a certain point, like, we don't want quick fixes anymore. We want lasting changes. You, from a financial perspective, you don't want to have to keep paying that therapist or chiropractor or whoever it is every single week because you're dependent on them making you feel better. From a scheduling perspective, you don't want your time to be tied down to, I have to have this weekly appointment or bi-weekly appointment or whatever it is, because that's the only thing that makes me feel better. We want you to be independent. We don't want you to be dependent on the therapist. That's going to create a lot of issues with long-term changes. And again, you don't have time for that. You 3 years from now don't want to be sitting doing the exact same thing and be stuck in the exact same place. You want to feel like you are in control of your own body. So again, in the beginning, starting with a lot of hands-on work in manual therapy, 100% do it. As you start to transition and you're not having as much acute pain or stiffness or tightness or symptoms anymore, the therapy should be evolving with you. So it should start to look a little more like movement re-education and strength building, with bits of manual therapy sprinkled in as needed. Because again, like, of course, massage feels good, right? There's never a reason when it's not helpful. I'm sure there are, but very few reasons why it's not helpful for people. And so it's always something you can fall back on and you can still utilize, but you want to utilize it because it feels good, not because you have to have it. It's the only thing that makes you feel better. There's so many other things that are much more effective that will make you feel better long-term than being dependent on any sort of manual therapy or foam rolling. All the time I get people who maybe aren't going in to see a practitioner, but they're doing foam rolling and they're like, I spend an hour on my foam roller every single day and it feels better, but then I do the workout and like all the pain is right back. To me, again, number one, that's not working, right? That plan is not working for you. It's obviously not getting rid of your pain long-term, but also what a waste of time. You're spending an hour on a foam roller, theoretically getting the exact same result that you would get if you only spent 5 minutes on the foam roller. But we sometimes have these beliefs that the more that I do, the better it's going to be. And, there's this belief that like I'm working out the knots in my muscle and I'm making it more pliable. And that's not actually what's happening, which is why you go to move again and the pain comes right back. So let's talk about what is actually happening when you're doing any form of manual therapy. It can be physical hands-on from someone else. It could be foam rolling, massage ball, Theragun, whatever. So what is happening in the muscles? Well, essentially, you are changing the input that the body is feeling. So let's talk a little bit about the way that pain works. So our body can sense one input. It can either sense pain or it can sense something else, some other sort of input. This would be the same idea as like when you stub your toe, what do you do with it? You grab it, you rub it, and it makes it feel better, right? And it's because your body switches over from being able to sense the pain input to your brain to the manual touch of rubbing your finger or your foot or whatever it is. And so in a sense, this is also what happens when we're doing soft tissue work, which is why it feels so good while you are on the foam roller. Your body is sensing the input from the pressure of the foam roller instead of the sensation of pain. So in the moment, it makes it feel really good. This is also why people use TENS units, right? It's the same idea. They sense the tingling instead of the pain. But when you take that stimulus away, you haven't actually changed the muscle in any way. And so very likely the pain will return and your body will start to feel those pain sensations again. Now, it's a little different from a TENS unit in that a TENS unit truly doesn't change the muscle at all. So like the pain comes right back after. Where if you're using something like a foam roller, there is some change happening, but it's not what you think. It's not that you've like smoothed the knots out or worked the knots out. It takes like thousands of pounds of pressure to actually change fascia and tissue. It's not an easy thing that you can just like roll a knot out, which is sometimes I think the picture that we have in our brains. What you're actually doing is you're signaling the nervous system to let go of the tension that the muscle is holding. So our body, let's use our glutes, for example, because that's an area that holds a lot of tension in impingement and labral tears. So our glutes are tense and they're holding all this tension. And so we do a little soft tissue work. And what it does is it tells the nerve, it signals to the nervous system to let go of the tension and release the tension from a deeper level. It's not just that we're like using a rolling pin and like physically smoothing out dough or something like that, which I think is sometimes what we imagine. And that's why people spend so much time on the foam roller. So the reality is, if we are just changing that nervous system input and the tension that your body's holding on to, you're going to get the same effect whether you spend an hour on that foam roller or with a massage as you are going to get with 5 minutes of it. Now, with manual therapy, like, yes, sometimes a longer massage is still helpful. We can hit more areas. We can kind of move around. But the reality is, like, we can sort of sense when that muscle starts to release and let go. And once it has, you really have done your job. So you don't have to spend hours and hours doing this. You're just looking for that feeling of release. Now, if it's, for me as a physical therapist, I can sort of feel this with my hands happening in the body. You as a client, if you're doing it on your own, it might take you a little bit of practice of doing it before you can actually sense that, like, what does it feel like to get the relief? But really, you're just looking for symptom reduction. So things feel like they've sort of let go. If you're not feeling any sort of symptom reduction, then what I would look at is, well, what are the other factors that are happening? What is your nervous system doing right now? Are you still under this tense protective phase? Because if you are, possibly doing something like adding in some diaphragmatic breathing while you're doing your soft tissue work can be really helpful, because now it's also signaling the brain to let go of that tension that you're holding onto. So the foam rolling or the tennis ball now becomes more efficient. The other thing that I think is really important here too is the timing of how you do things. So how we utilize the manual therapy is really helpful. So if we know that it's helping change the input, the sensation of pain, it's also changing the nervous system response and that protective guarding. If we are struggling through a workout or through exercises or running or whatever it is, and you're feeling a lot of stiffness and restriction, and I guess that there's that protective guarding, right? Then what we can do is maybe doing some diaphragmatic breathing with your soft tissue work prior to the exercise would actually be really helpful, because then it would allow you to get the mobility and the movement fluidity that you need during your workout for your workout to be more successful. So sometimes putting it on the front end of exercise is really helpful. There's also a place for putting it on the back end of exercise. So this is really helpful for cool down, right? After we work out, we work really hard. There's all these waste products that our body releases, that our muscles release. And these are good things. These are normal things that happen, right? You've heard of lactic acid before. So things like this. And so it releases these waste products. And then after we just stop our workout, if we haven't done a good cool down, all of that waste just sits in those muscles. And it's kind of like this like inflammatory soup, right? Like just sits there. And so cooling down with some mobility work, some foam rolling, some hands-on soft tissue work, this is where it actually helps cool the muscle down and filter that waste product out so that you don't get that delayed onset muscle soreness that you probably all know really well. So there's a place for using manual therapy for a lot of different things, but the timing of when and how you use it also can be extremely important. For some people, prior to exercise is going to be the golden ticket, and then for others, afterwards is going to be where they find that it's most helpful. Sometimes we can do a little combination of both, but again, we're not spending an hour on the front end and an hour on the back end. We're talking like maybe you roll on the foam roller 10 times before and 10 times after. Like it doesn't need to be this long drawn out process that we sometimes think it does, but just using it strategically for what your body needs. And the bigger thing, as I've already mentioned, is also recognizing then that it is not the only piece of the equation. It's not the only thing that's going to make you feel better. It will help you feel better in the moment. We are going to use it as a tool, but we are not going to use it as our complete plan, because it isn't a complete plan. We then need to make sure we are learning those movement patterns, we are ingraining them into the way that you're doing day-to-day tasks, exercise, whatever it is, and then we are teaching your body to do it under load and a higher demand, and this is where the strength piece comes in. Hip impingement and labral tears are very often, you've heard me talk about it a million times, but they are very often a movement-based issue. Yes, there are some structural things that happen as well, but almost everybody that even has the structural problems also has the functional movement problems. And so we must address those issues no matter what. And without it, you're missing really the whole point. So using the manual therapy strategically alongside these other pieces of the equation, that is where you are going to see the biggest change. You're going to be the most efficient with your time, and it's going to overall that's what's going to make you feel better. I think that there are certainly a few, I guess, red flags, if you want to call them, things that you should watch out for if you are somebody that is going to a physical therapist or a massage therapist, chiropractor, like whatever. If you're being treated for your impingement and your labral tears, there are some things that I would watch out for as a sign of maybe this isn't working for you, the way that you're doing things. So this would be if you are going in and you're having your appointment and the bulk of the appointment is manual therapy. Now, again, in the beginning stages, the first couple of visits, that might be truly what it needs to be, especially if you're super inflamed, super irritated, everything hurts. You might need a good session of a lot of hands-on work, and that's okay. But eventually, hopefully within the first 4 weeks, you're starting to veer away from such a heavy hands-on component of your therapy, and maybe it turns into 20, 30 minutes. And it basically decreases over the course of time because you should be starting to feel better. So if all you are doing when you go in to work with somebody is hands-on manual therapy and nothing else, then I would kind of look at that plan and say, okay, what maybe needs to be added in here? Maybe it's a conversation that you have with them. Hey, I'm not doing anything for strength right now, or this it feels better when I'm in here, but it doesn't stay better. Like, what can we add to help prolong the effects that I am getting with this manual therapy? And again, ideally, that should be exercise. It should, and lots of different things it might be. It could be movement retraining. It can be mobility work. It can be strength training, like whatever it is that your body needs, but some form of exercise to help make the manual therapy stick. If there's the other red flag that I would say is if they're not giving you a clear plan or strategy. If they're just saying, come back next week, or I need to see you 3 times a week for the next 12 weeks, and there's no plan, and they haven't explained their plan to you. You ideally should know, like, what is my course of action here? What is, like, yes, I'm going to do some manual therapy, but what else am I going to do? And how are you going to make it so that I don't have to be dependent on needing that manual therapy? What's my plan to eventually be independent someday? To me, that's a red flag if they're not giving that to you, because it's a little bit of a cash grab, I think, truly. I know a lot of practitioners are not going to like that I'm saying that, but I really think it is a bit of a cash grab because they've made you dependent on them. And that's not what this should be. This should be, in the beginning, maybe yes, but over the course of time, they're teaching you, how do I make these things last and stick and move in ways that I'm going to get long-term benefit without having to keep coming back in to see you. Obviously, if you're not getting any progression with anything that you're doing, that's going to be a red flag. If they're not giving you any sort of education on what's going on in your body and how you can make changes, how you should be moving, like that's also all red flags. And you guys have probably at this point heard me talk about all of these things. And really it all applies exactly the same here with manual therapy. So for me, how do I use manual therapy? Now, again, I'm by no means anti-manual therapy. I know I spent a lot of time talking about how it's not the only piece of the puzzle. And really that's just the important piece of it, right? So as long as you're using it in a way that is strategic and that it is helping, then by all means, keep doing it. If it is making you feel good, keep doing it. Just make sure that there's a plan in place, right? So when I see clients in the clinic, then of course I'm going to use some form of manual therapy. Not every session is focused on it. And I make sure that the client knows that it's not every single session that you come in, we're going to rub your hip, you know? In the beginning, I do it a lot more. But once we start to get to sessions where they're like, I'm not having any pain, or, I'm pain-free today, or I haven't had any problems this week or whatever, I'm probably focusing the majority of my session on something else at that point. I'm probably not spending all of my time on manual therapy. A lot of times what I will then do is say, okay, great, you're feeling good. Let's do all the exercises first. And then at the end, we're going to spend 5-10 minutes on a little bit of manual therapy just to make sure you feel good. We'll use it as your cool down so you feel good when you walk out the door. Perfect. They get their manual therapy, but it's used strategically against or with, not against, with the exercises that we've done in the session. And now it's our cool down. There are times where somebody will come in and they are in pain, and I don't always jump straight to manual therapy first. I will often say, okay, you're in pain, so not great, but it is great because let's try some exercises so that without me ever touching you, we can figure out, are there movements that make you feel better? Because guys, this is gold when the patient can figure this out, or you can help them figure it out, because now suddenly you feel in control. I had pain. Jenna showed me this mobility exercise and maybe this other movement thing. And then I got up and I didn't have pain anymore. Guess what? Now I know next time I have pain, those are the things I'm going to go to. So my favorite thing to do at a certain point is when they walk in with pain, I'm doing movement and exercise first to figure out what makes them feel better before I ever lay my hands on them. And then once we know that, okay, now we can go do our manual therapy. You're already feeling better. Or maybe we don't even need the manual therapy at all. Maybe you've calmed things down so much that like you're good. And that happens too. So I think, again, there's a place for it, but there's got to be a strategy behind how you're using it. To be honest, guys, these days, the majority of who I see, I do virtual coaching. I'm not even doing in-person physical therapy the majority of my days anymore. So guess what that means? That means I'm not laying my hands on my clients that I'm seeing virtually through the screen. They still get better. And why do they get better? Because I teach them how they can do it themselves. Again, maybe it's foam rolling or something like that if they do need hands-on work. But also it's through the movement. I am a big fan of using movement, re-education, strength training, and the whole core framework that I walk people through. That's what gets them out of pain. It's not the hands-on manual care. So can you work with somebody virtually and still get the same or better results? Yeah, I'd say that you can. And in a lot of cases, I actually think you get better results because there's no dependency. There isn't this idea that unless my therapist lays their hands on me and massages me for a half an hour, that I'm getting my money's worth and that's the only thing that's making me better. When I work with people virtually, they know I'm not going to put my hands on them, but they still start to see changes because they're more in tune with what's happening with their body. And I'm teaching them how to get rid of their pain in other ways without needing something manual. So I hope that this all makes sense for you guys. I think the biggest takeaway here to realize is that the strategy is more important than the treatment itself. Do we love manual therapy? Yes, 100%. I am always going to use it. I am always going to be an advocate for it. But more importantly, I'm going to advocate for the effective use of it, a strategic use of it, and it not being the entire plan, but just one piece of the puzzle to get you feeling better. So hopefully this was helpful. If you have any questions, I'd love to hear your experiences with manual therapy. Was it helpful? Was it not helpful? Did it feel like it kept you stuck? What worked for you guys? I'd love to have these conversations and hear kind of from you and what's working. So drop me a comment below. Let me know your experiences around having manual therapy for this issue. And of course, if you have any questions, just let me know too. I love connecting with you guys. So I hope that this was a great episode for you, helpful episode, and I look forward to seeing you here back next week on the Unchoreographed podcast. Have a great week, guys.